We had to create a system where we'd be able to take care of our routine patients, those are patients with heart attack, the strokes, the accidents, and the gunshot wounds, and those kind of things. But at the same time, have a system in place that we can separate those patients from patients with suspected COVID. So we had to restructure our system to have a special area that caters for COVID patients or suspected COVID patients, and also at the same time have the area that exists in space to take care of patients that have symptoms that are unrelated to COVID.
That was Dr. Zulfikar Box, head of the Accident and Emergency Unit of the Georgetown Public Hospital Corporation, explaining some of the measures implemented to effectively accommodate emergency patients while simultaneously preventing the risk of cross-contamination. According to Dr. Box, both COVID-19 and non-COVID-19 patients are being managed in an effective and efficient way. He added that while the procedure to access medical attention at the GPHC has not changed, patients are now required to undergo screening before entering A&E by doctors and nurses.
When you come in at the emergency room, so at the door there's a group of doctors and nurses who will actually ask you questions and stratify you in terms of your risk for COVID. So depending on your symptoms and your presentation, they will determine if you are at high risk, intermediate, or low risk for COVID, and you'll be managed accordingly. If you are clear for COVID based on your history, then you're managed according to how you were managed before, and you're brought into the department and care is being administered. If you are suspected of COVID, then you're managed by at the COVID areas. We have the COVID intermediate and we have the COVID emergency, immediate and urgent areas, and depending on your condition, you're brought into those areas where staff who are fully protected are there to manage you.
Dr. Box reminded that during this time, visitation to inpatients of the hospital is still prohibited, and anyone seeking medical attention can only be accompanied by one person. The head doctor of the Accident and Emergency Department is also reiterating to the public that unless they have a dire emergency, the hospital is not the place to be during this public health crisis. He repeated his calls for persons with non-urgent medical conditions to utilize the outpatient unit of the hospital and health centers in their communities instead of coming to the Georgetown Public Hospital Corporation to access services. While there is a deficit in protective equipment for medical practitioners, the GPHC has implemented a system that ensures that its medical staff, especially those dealing with COVID-19 patients, have access to the requisite protective gear at all times. Dr. Box reminded that to enter the hospital, it is mandatory to wear a mask.
Every staff and patient that comes into the department have to be masked. So if everyone, as you are aware, if everyone wears masks, the risk of the virus spreading is far lower, and the studies are now showing that if everyone wears masks, not just in the healthcare system but in the general public, it actually has decreased spread quite a lot. So we have healthcare workers in the regular non-COVID setting that are all masked and gowned, but if they reach the point where they have to take care of COVID patients, they have the requisite protective equipment.
Amel Griffith for the HGP Nightly News.